The most dangerous phrase in English language is "we have always done this way." This is one of the most difficult things to change. This also happens in refractive surgery when one fits everybody. We at NN want to recreate this and always ask questions that each person we have to do it differently. And that is what the power of refractive surgery clinics at NN. Let me discuss something more in detail with you. So how are we different? We are different because we attempt every time to merge science, art, skill, technology and machines. Each and every one is very important. Every member of what I just described forms a very integral part of when you do a surgery. The science is important because science is all about what we have done research on, how we work on every aspect of your eye. We sometimes takes the tears and try to analyze what inflammations are there, which could probably cause dryness or cause haze or delay recovery. We use the art of research into practice. We use the technology, which is multiple ones, the diagnostics, and we try to merge them to the laser machine, which is very important because there has to be a healthy marriage between the laser machine and the diagnostics, and we try to integrate that. These machines are our strength. This is what tells us what I should do. Every single machine has its own uniqueness. It picks up the uniqueness in you, and that uniqueness is transported to the Lasik machines, which offers the treatment to you. So these are my pillars. We bring in a completely new concept of AI-driven simulation. That means it tells you how weak a cornea can be after surgery, and based on that we change. This is probably one of our own invention. We call it the AccuSim. AccuSim is the trade name of an AI-driven simulator which we use. We bring in different kinds of machines in the OT which can talk to each of these diagnostics and helps to give the perfect treatment. And finally, the skill of the surgeon. The team which I work with, myself, my assistants, my colleagues who also do refractive surgery, my OT assistants, the people who clean the machines, the instruments. It comes with thousands and thousands of surgeries where you enhance the skill to a stage where we can offer comfortably what we can achieve at the end of the procedure, or what the kind of vision you wanted to see post-surgery can be achieved by a healthy mixture of all these factors what I just mentioned. What makes refractive surgery at NN so special, which I am proud of? It's special because we merge many things. For example, when an artist or a sculptor wants to create a piece of art, or you want to create a statue, he thinks, he plans, he envisions, and then he puts it on the canvas or the marble. This is exactly what we as refractive surgeons do at NN. If you come to us and we do a basic scannings, which runs from a basic topographers to epithelial mapping to strength of your corneas, to AI platforms, to abrometries, which looks at the imperfections, and multiple other things. So many times patients come and ask me, there were so many tests done, what are you going to do with it? That's what the power of refractive surgery at NN is. When you do too many tests, each of those tests has a particular reason why it's been done. Once we do it, all that goes into your intelligence, and also we use some artificial intelligence. We combine both. These inputs decide what type of surgery is the best for you. Second, does this cause any problem to you later in life? 3, should I do a surgery on you or not? All these 3 things are very important. The power at NN is to combine all this imaging, artificial intelligence, human intelligence, skill, thinking, technologies into one capsule and offer it to you. That's the power. That's the power what you get, and that's the power what we have to use all these platforms for your own good. So let me just now take you to the OT and discuss with you that whole concept of what really happens. I just showed you the machines which can diagnose, and also the machines which can treat. Let us just take you to these two places now. And what you see here is the world's best machines from Zeiss, from Alcom, from Zeiss. This is the Smile, and all these machines are all under one big roof. This is something which you don't see often. So what we do and what is special in NN is when a person comes for a refractive surgery, it's not about fitting everything into one machine. It's about fitting into different machines and trying to see how they get merged. Which one would be the best one? Which one would give you the best quality of vision? Which machine is made for you, for your kind of corneas? This is the most powerful reason why NN's refractive surgery clinics is one of the world's most advanced centers. It's advanced because not just of machines or individual like me or my colleagues or the people who make it, it's because there's a mix of science, art, skill, and the machines. When you merge everything together, we attempt with God's grace to give you that perfect vision which is custom fit for you. That's something which is made specially designed for you. And that is what makes NN Refractive Center special.